We all definitely crave to have a good sleep, but there is some sleep which can't be regulated. In fact, it controls you, the sleeper, disturbing your sleep cycle. This should be alarming. Dr. Charles WAMBOGA, the program manager for sleeping sickness control in Uganda, working with the Ministry of Health, says it's one sign that a person has been bitten by a tsetse fly has sleeping sickness.
Fever, which fails to respond to treatment, has headache, or has had any treatment for malaria, that person should visit our nearest health facility.
Other signs and symptoms include joint pains, itching, change in behavior, confusion, sensory disturbances and poor coordination.
It is endemic in 40 districts within the country, and we estimate that a third of the country's population is at risk.
Then we have two forms of the disease. The one which is chronic, which has been affecting the southeastern part of Uganda, stretching to Teso, now up to Kabaramaido. But there is another one which is chronic, what they call the Gambianse type, in the northwestern part of Uganda.
Dr. Nicholas KAUTA, the Director Animal Resources in the Ministry of Agriculture, Animal Industry and Fisheries, says that tsetse fly is on rampage, covering 70% of Uganda.
The disease affects cattle, pigs, goats, practically all mammals. It is even found in some reptiles. At least about 2 million animals in the country suffering. They can hardly give milk. Their growth rate is so low, and farmers are working for nothing, and the animals tend to die.
Those that survive are sustained on drugs. This, however, does not offer whole protection to humans.
If people are going to get the milk, then they are probably taking traces of such drugs as well.
For this reason, Susan Welburn, a professor of medical and veterinary molecular epidemiology at the University of Edinburgh in the UK, refers to tsetse flies as not being the bad guys.
The bad guys are the parasites which are actually in the animals, and we can prevent those parasites being in those animals by using appropriate veterinary drugs to keep the animals clean of these parasites, and also to prevent the flies from biting these animals. Cows don't like being bitten by flies anyway.
There are other areas of the country where the tsetse fly do not have this disease. We don't want it to spread into that population of tsetse flies and human beings and animals.
The main challenge is to stop animals from getting reinfected.
You need to use a pyrethroid-based insecticide. It'll keep your flies off and it'll keep your ticks off. And if you're worried about money, you can use a restricted application method where you just put the insecticide in dip formulation on the tummy and the legs of the cow, not all over the back where it'll wash off with the next rain.
Treatment of Nagana in animals is not as complicated like in humans.
A single shot with a good drug like they call Berenil can clear. The human being is different. Human beings go through prolonged treatment.
The patient is supposed to be hospitalized. Most of the drugs are either given by injection or through the vein. So you actually need people who are really trained.
Sleeping sickness in people is really, really difficult to treat, and it's really expensive. It's estimated that it costs about $120 or so in patient costs and treatment care. But treating an animal is actually very straightforward. It costs probably about 50 cents to buy a trypanocidal drug to keep your animal clean.
And that's why emphasis is on prevention of infection in people. The Ministry of Health, as well as Agriculture, Animal Industry and Fisheries, have been at the forefront of this.
We have been deploying tsetse traps. These traps are very, very attractive to the tsetse fly. We also treat them with insecticides so that those which may not directly enter the trap but just touch the surface also die. The other approach, we can apply the chemical on the cattle. That's what we call the moving targets. When the tsetse flies go to feed, they pick the lethal dose of the chemical, they go and they die.
A study published in the Cell Cycle, a scientific journal, indicates that Virginia Tech researchers have discovered a possible drug target that can combat sleeping sickness. There is no vaccine though.
We don't even have a vaccine for malaria. Vaccines are very good for viruses, they're not very good for parasites. And the trypanosome that causes the disease has evolved a very, very clever way of avoiding being caught by our immune system. It basically changes its coat every 3 or 4 days, so I think we're maybe 20 years off a vaccine.
Since the number of new sleeping sickness cases has reduced tremendously between 2000 and 2012, the WHO has set its targets on eliminating this disease by 2020. But for developing countries, resources are limiting the efforts. Florence, NALUYIMBA, NTV.